Institute.
Good evening, everyone, and welcome to the Milken Institute School of Public Health at the George Washington University. And welcome to those of you in the Overflow Convening Center as well as online. We wish we could have accommodated everybody into this room. It's wonderful to be together tonight as we continue our celebration of National Public Health Week. This is a moment each year when we come together as a community to reflect on the power of prevention and the importance of strong science-driven public health workforce. We are especially honored to be joined this evening by John Green, a best-selling author, an advocate, and a compelling voice for public health. This is not a book event, but he did just write a new book, Everything is Tuberculosis. It is a remarkable and timely exploration of one of the world's most persistent infectious public health threats. And I would say it is also an example to all of us in public health of the importance of storytelling. Here we have a storyteller par excellence. We're so lucky to have John Green with us. John, we're thrilled to welcome you to George Washington University and so grateful for the way you continue to elevate critical health issues for a wide and passionate audience. Speaking of the audience, I have a surprise for you. Those of you in the auditorium, under 20 of your chairs tonight are envelopes. Please check. If you're one of the lucky ones to find an envelope under your chair, congratulations. You've just won a signed copy of John's new book, Everything is Tuberculosis. It looks like this. If you have one, raise high. Let's see it. Well, where'd they go? We promise they're there.
They're there, I promise. If you get up out of your seat.
You may have to stand up to find it.
There you go.
Okay, there we go. Now they're showing. Yay! All right. Okay. Silence. Okay. At the end of the evening, those of you who got a ticket, head to the registration desk to turn in your ticket for your signed copy. We hope that this little gift inspires you to read deeply, to think critically, and to stay engaged in the public health challenges that shape our world. But before we begin the conversation, I also want to take a moment to recognize our incredible Public Health Student Association leaders who are here. Hello. They are brilliant and passionate about the future of public health. Can they please stand and be recognized? Come on, I know you're here. Yay. It is now my honor to introduce someone whose leadership is helping to guide this school into its next chapter. Dr. Timothy Holtz joined us last summer as director of the Sumner M. Redstone Global Center for Prevention and Wellness and professor of global health. He is a board-certified physician, an accomplished epidemiologist, and a widely respected leader in public health and global health policy. Prior to joining us at GW, he served as deputy director of the Office of AIDS Research at the National Institutes of Health, and he brings more than 30 years of experience across prevention, health systems, strengthening, and global emergency response. He also brings some TB experience to the discussion tonight as the co-creator of the entity we call XDR-TB. Tim has already made an impact here at GW, and we're lucky to have him at the helm of the Redstone Center. Thanks to all for being here tonight. Please join me in welcoming Tim Holtz.
Don't forget your copy, Dean. Is that your copy?
It's not, but I'm going to take it.
Thank you so much, Dean Goldman, and good evening to everyone. Welcome to this exciting event as part of National Public Health Week. My name is Timothy Holtz. I'm the Redstone Chair and the Director of the Redstone Global Center for Prevention and Wellness, located within the Department of Global Health. I'm so pleased to be able to moderate our conversation tonight and thrilled to have John Green with us in a conversation about the role of advocacy in the fight for global health equity. John, I've actually been on and off nerd fighter for about 10 years or so, since 2014. I wasn't in your first million, but I was in the second million. And I've always found your mix of adult wisdom, nerdiness, sincerity, wonkiness at times, and passion, and is always a breath of fresh air against all the noise and the misinformation that we see online. So thank you so much again for joining us in your busy schedule. So just for everyone, just 1 minute on the Redstone Global Center. Some of you may not be familiar with our work. The Redstone Global Center develops and translates knowledge into practice and policy to advance prevention and wellness in the US and globally, and enhances our schools' leadership efforts to extend, expand, and accelerate the global health transformation that prioritizes prevention. Since its establishment 10 years ago in 2014, through a generous gift from the Sumner Redstone Charitable Foundation, the center has advanced this mission through policy, research, and advocacy, support of community-driven initiatives that promote the health of people and the planet, unwavering attention to health disparities, and the promotion of systemic change. With our renewed strategic plan, the Redstone Global Center is building on this rich legacy to foster healthier global communities by addressing the critical impacts of climate hazards, working with communities that are most at risk, cultivating research, education, and collaboration. Our conversation this evening is co-sponsored, as the Dean said, by the Public Health Student Association and the Dean's Office. Thank you, Dean Goldman, for your leadership during this very turbulent time in public health. And I've heard it described as like riding a roller coaster in the middle of a tornado during an earthquake. And we'll no doubt touch on what we can do on this current roller coaster ride tonight, or as John describes it in his New York Times article, interview, which you may have seen, it's like we've fallen down the stairs. John Green is an award-winning #1 best-selling author of books that all of you are probably familiar with, including Looking for Alaska, The Fault in Our Stars, Turtles All the Way Down, and The Anthropocene Reviewed. With his brother Hank, John has co-created many online video projects, including the Vlog Brothers, educational channel Crash Course, and the annual live stream fundraiser called the Project for Awesome, or P4A. John serves on the board of trustees, which is what you may not know, for the global health nonprofit Partners in Health, many of whose staff have joined us here in the front row. Thank you for coming. And in partnership with Partners in Health and the Nerd Fighter community, he has raised over $30 million to tackle maternal mortality in Sierra Leone. In 2023, John spoke at the UN calling for the eradication of tuberculosis cases in the next decade. He lives with his family in Indianapolis, and you can visit him online at johngreenbooks.com and find out more about the fight against TB at tbfighters.org. Allegra Mbwechengal is the second-year Master's of Health Administration candidate at GW here. With a strong background in healthcare management and patient care, she gained hands-on experience as a medical assistant at the Virginia Hospital Center and Summit Spine and Joint Center. In addition to her professional experience, Allegra serves as the president of the Public Health Student Association at GW, as you heard, leading diversity and student engagement initiatives that foster inclusion and professional development in her academic community. Allegra leverages her multilingual background in French, Swahili, and Lingala, as well as English, of course, to bring a global perspective to healthcare. She's dedicated to addressing health disparities and improving access to quality care for underserved populations. As an international student herself, she is also passionate about educating others on the international student experience and actively advocates for the rights and inclusion of international students in academic and professional settings. And Vincent Lin is Associate Director of Health Policy and Advocacy at Partners in Health. I have to say Dr. Jim Kim wasn't able to join us tonight, but you're in for a treat because Vincent spends a lot of time in Washington and really knows how to work in this city. He began volunteering as a fundraiser and advocate with his local PIH Engage team back in 2014 and supports grassroots and coalition advocacy efforts around federal health policy and appropriations. I know firsthand that he spends a lot of time here because I've advocated with him before already. Vincent is one of the organizers for the 2025 World TB Hill Day, which is tomorrow, bringing together multiple organizations and grassroots networks with TB survivors and 200 advocates who will meet with nearly 200 congressional offices tomorrow. And they were all trained here this afternoon, and I thank Partners in Health and Vincent and his team for doing that. He previously worked at Harvard University with Dr. Paul Farmer and colleagues on TB policy, education, and in a TB research lab. You can check out ways to get involved at pih.org. So I'm now going to invite Vincent up first, actually, to give a little bit of short, well, you can stay in your seat, a little bit of short introduction about PIH work on TB and HIV in Peru, Russia, and Rwanda, and how we got to be here.
Thanks, everybody. It's really an honor to be here. Thanks for having us here at the School of Public Health. Partners in Health has had a long journey, and it's amazing to be here with many of my personal heroes who've made that work possible across Lesotho and Liberia, Peru, and over decades, Russia of work. And, Partners in Health has really shown the world how to deliver healthcare in so many different communities and settings, and brought those best practices to their partnerships with other ministries of health. And community health workers, for example, is something that it's a magic that sort of makes healthcare delivery work in many rural settings in particular. And Partners in Health has been a big part of scaling that model up globally. And my predecessors, Dr. Kim, you mentioned, Dr. Farmer, and others, have spent a lot of time here in DC actually doing the work to bring those lessons learned from the field and from spending time in clinics and hospitals to policymakers who will be able to help turn that into larger scale solutions, whether that's advocacy for the creation of the Global Fund, the creation of PEPFAR, the President's Emergency Plan for AIDS Relief, or USAID, the Agency for International Development's Global Tuberculosis Program, which a lot of us will be talking about tomorrow on Capitol Hill with legislators. And so it's really cool to be in a room here with multiple generations of PIH implementers and advocates, and amazing that we have 200 meetings tomorrow, 206, I think, with 94 senators, for example, about TB. And because I was a student organizer for 10 years, I will say I'm happy to chat one-on-one with anybody who wants to talk about getting involved in advocacy work and how you can join the GW PIH Engage team, for example. Shout out to Lena and Caitlin, who are some of the team leaders there. You can email me, we can chat. My email is vlin@pih.org, L-I-N. Happy to talk anytime about how to get involved with student organizing, how to learn the skills and tools to be an effective advocate, and we'll plug you in. So you're all welcome. We need more people in the movement, and you all are, because you're in DC, you're in a great place to actually do that on any given day when you don't have an exam. Just go meet with your member of Congress, talk about tuberculosis, join us for Hill Day next year. And I will say, last year, and for the last 10 years, TB survivors and advocates have been on the Hill talking about USAID funding, the Global Fund to fight AIDS, TB, and malaria, which the US makes a contribution to through this sort of multilateral pool. They've talked about the funding for the CDC's TB program, but they've never done it with so many people. And I think a huge credit of that is to you, John, and engaging this community that you have, this following, using your megaphone to bring more people into this effort. And so it was amazing. Some of the organizers who have been doing this for 10 years were, in tears earlier today, talking about how much it means for hundreds of people to come to DC to advocate for this issue, even though a lot of folks they aren't survivors. They're not physicians, they're not nurses, but they have been so moved by John's teaching and John's content, by his book, to pay for themselves to come to DC, talk to their members of Congress about why this matters, not just for 2025 and everything that's going on this year, but for the long run. And so I encourage you all to join us, follow us, TB Fighters. You can search that. You can go to the website. We got folks who are involved in that, pih.org, and find out ways to get involved yourself. And we welcome you with open arms.
I'm really jonesing for those socks.
Oh, they're available. Yeah. No, they're from the Awesome Socks Club, and all the money that's raised by this is my brother's stupid idea that's raised millions of dollars. All the money that's raised goes to PIH's work in maternal health, so it's pretty awesome.
Great. So I'd like to start this conversation with you, John, about some questions about the role of advocacy in global health. What inspired you to use your gift of writing and your platform to advocate for global public health issues?
Well, Vincent is very kind to say that I'm the reason why there are so many people coming to Hill Day tomorrow, but the truth is that they led me much more than I led them. And they reflected the values of our community back to me. You know, I was a novelist. Like, I thought of myself as a writer, and I thought of my work as a writer as being to close empathy gaps, right? Like, when you read a book, like if you read Catcher in the Rye, you know, you don't think of Holden Caulfield as your friend or your spouse or your sibling or whatever. You think of yourself as Holden Caulfield, and that's the magic of reading. It shrinks the gap between people and allows you to become someone else. When I read Toni Morrison's Sula, it's as close as I'll ever be to being Sula, you know? And so that was what I thought my work was. That's what I thought I was on earth to do. And people in our community kept saying, no, you should be doing other stuff. Like, you should be doing more. You should be doing more interesting things. You should be using the benefits and the platform of this community in more interesting ways. And so we started out doing that like very early on when we started making YouTube videos in 2007 when most of y'all were not born. You were alive. That's great news. That's great news. I hope I'm still making videos and talking to college students when they're like, oh yeah, no, I wasn't a person yet. I'm delighted to know that you were alive. That's a huge encouragement to me. Oh yeah, but still, it was a long time ago. I don't, oh, thanks. So anyway, you know, we started making videos in 2007, and almost immediately people were like, this is cool, but we should be doing more. Like, we shouldn't be like playing each other in chess. We should be doing something interesting and important, and that's why we started the Project for Awesome. That's why we started working with Partners in Health back in 2010. And, you know, ultimately that led us to this moment, to working on maternal mortality in Sierra Leone and working on TB globally, because they pulled us in that direction. They taught us that my job isn't just to close empathy gaps through fiction. My job is also to close empathy gaps through advocacy.
You mentioned the magic of books and reading, and I was telling Dr. Holt and Dean Goldman that I remember vividly where I was when I was reading the end of The Fault in Our Stars. Like, it's still there. I see it in my mind. And I didn't realize it then, but I realized that it made me curious about health.
Oh, wow. Bees. Thanks.
But now, I mean, when I read it, I was 13. Now I'm 24. So I didn't realize it then, but now I realize that it kind of like sparked my interest in healthcare. So I had a question. How can students and young professionals like I am get involved in advocacy effort?
Well, I think Vincent has great ideas, and I'd be interested to hear his response to that too. But I think, you know, the most important thing is just to dive in. Like, I really didn't know that much about tuberculosis. Like, in 2019, I didn't know anything about TB. I didn't know that it was still the deadliest infectious disease in the world. I didn't know that it affected 10 million people a year, that it killed over 1 million people a year. I didn't find that out until I was in Sierra Leone to learn about maternal health, and Partners in Health asked me to go to a TB hospital, and I was like, there's still TB hospitals? I was shocked. And when I was there, I met a young boy named Henry who really changed my life. You know, sometimes people are put in your path and you don't know why, but through meeting Henry, I became a much more public advocate, and then came home from that trip, and I was like, I got to learn about tuberculosis, man. Like, what is wrong with my information feed that I've gone 43 years of being alive with no idea that this is still the deadliest infectious disease in the world? Like, what's wrong with my Twitter? It turns out, a lot. But at the time, I was still, using it regularly. And so I started reading about tuberculosis. I started learning about tuberculosis. And one of the cool things about being interested in public health as opposed to being interested in something else is that like somebody like Vincent will be like, just email me. I kept reading this person named Carol Mitnick in all these articles I was reading. I kept reading about this person named Carol Mitnick. She kept getting mentioned in all these health articles. She's here tonight. I'm not going to look at her. It's going to be awkward. But I called her at like 9:30 on a Wednesday. I was like, I'm just going to email Carol Mitnick, whoever this is. She's at Harvard. She's a professor at Harvard. I was like, I'm just going to email her. I'm just going to do it because there's a bunch of questions I have. None of these papers answer them. They're like elementary questions, but I couldn't find an answer for them. So I wrote her at like 9:30 on a Wednesday, and at 9:32 on Wednesday, she was like, can you call me now? I'm like, that's the great thing about public health is that people are ready to talk. They're excited to be part of this. Like, they want to talk to you. They're enthusiastic. They're passionate. You try to do that with an art curator, like my wife is an art curator. No way, man. You do that with a novelist, like, no disrespect to my field, but like, if you email me, I'm not going to email you back. Email Vincent. Vincent will email you back.
I will definitely email you back. So please email me. I think one thing that's great when you're in grad school or undergrad or when you're in school is you have more flexibility and time to learn all kinds of things, right? So much of the learning happens outside of the classroom too. And maybe your classes actually talk about how government funding is done and appropriations and how bilateral and multilateral health financing works. I'm sure that's actually part of your classes too. But you're also right next to the Capitol where folks are making those decisions every day and getting involved. I think trying to do those meetings for the first time, going to talk to your members of Congress about the things that you care about, whether that's domestic or global, whether it's fighting health inequity or any concerns that you might have, or your local school or your local park. I think that's a great way to learn. That's how I learned basically everything I know is trying to figure out what the barriers here or there, how do 302B allocations during appropriations work, who are the heads of these different committees. I think that's all really helpful learning that you can do by practice, actually. And I think that's a great way to get involved and to really hone your skills as an advocate, because so much of that is really kind of learned on the job or as a volunteer or whatever it might be. And understanding the mechanics of how the federal government works, I think is really empowering because you kind of understand how these decisions are being made that affect you and your siblings and your parents, your cousins, your grandparents, and it's not a total black box. You can actually figure out how that works, and if you email your member of Congress, they'll come meet with you, or you'll talk to their legislative staff and kind of figure it out from there. So I would say learning by trying is really what I would encourage.
And they're all people. Like, you think of the halls of power as being somehow like separate from you, or like your experience of the world, but they're just people. Like, I met with a senator today and I was hanging out with him talking about tuberculosis, and I was like, this is just a guy. Like, he's a guy I've seen on TV a bunch, but like, he's just a person. He's like normal. Like, he's talking about Shakespeare. He's curious about the title of The Fault in Our Stars. Like, he's just a dude. And this is what you come to understand, is that policy is made by people. And those people feel very distant from you, and that's partly like the structures of the social order that seek to, frankly, to disempower you and to empower the already empowered, right? We all know that's part of what the social order does. But like, they're just people. And then you meet with them, and they listen to you, and they go home, and they lay on their bed, just like you lay on your bed, and they go to their pillow, and just like you, they think about what they learned that night, and they think about everything that they did wrong, and they think about everything that everybody who talked to them, and they remember you, and they think about you, and then the next time they vote, they're like, well, but that person did tell me that tuberculosis is important. Like, I called my senator recently, Todd Young. I didn't call him personally, but like, I called his office, and I was like, you got to put some tuberculosis funding back on the on the menu, man. This is embarrassing. This is horrific and terrifying and awful. And the guy I was talking to, who's some 26-year-old kid, nothing against the 26-year-old kids in this room, He was,
Anyone over 40 is a kid.
yeah, that's my policy. He was like, I have been getting a lot of calls about tuberculosis. And I was like, good. So it does matter.
So let's turn our discussion towards health equity in low-income settings, if we can. So we've all seen the words that people have been told in the government to take out. Disparities in health, health equity, social justice. There are some in this city that want to wipe those words out of our lexicon. So how do we keep social justice at the top of our agenda when we work in low-income settings and advocate for increased justice in low-income settings? And notice I didn't say low resource, because there are many of these settings have high resources but low income.
Yeah, there's no poor countries in the world, right? There's just impoverished countries. There's communities that have been impoverished by colonialism, impoverished by, the forces of our world today. I think it's about who you center. It's about who you listen to, and I have a huge megaphone, and I'd actually like to turn off my megaphone for a moment and listen to somebody else for a second, because I have this big megaphone, and it's easy for me to talk over people. So I'm curious how y'all would react to that question.
I would say, from someone who was born outside of the United States and who kind of like saw all the different disparities, even though I was fortunate enough to kind of like have parents that can help me when I'm sick, I would say you need to, like you said, you need to put yourself out there and create the change you want to see. When I came here in the States, I told myself that there's no way that I will not find a way to make sure that when I go back to my country, I have the knowledge needed to change things around. And you mentioned a lot of your work in Sierra Leone, and I hope one day you can come to Congo too. But this is something that I want to do too, but I have to get the knowledge too and just put myself out there.
Yeah, education's so important, right? Like that's an important. Sometimes it feels like education is this like dry run before adulthood. I know that like many of y'all feel that way because you're in graduate school, but like you're doing adulthood. This is adulthood. It's happening. It's just that like you're in a certain phase of adulthood, and then you'll be in a different phase of adulthood, and then you'll grow up further. Like I thought that adulthood was this like place you arrived at. Do you ever think that?
I still think that right now.
Yeah.
I'm not an adult.
But you're not there yet. You think you're not there, but I'm telling you, you are there.
Oh my God.
I mean it though. And so are all of you. All of you born after 2007 are in adulthood. This is it. But like adulthood is not like a zombie apocalypse that you run from for as long as you can, and then eventually somebody tags you and you have to live with being an adult for the rest of your life. Like adulthood, like you keep changing, you keep growing in adulthood. And so I think it's beautiful that you were like, I need to go and get my education so I can continue to like provoke change. But like you don't have to fully wait until you have the degree to begin making the change. Like you're already making the change.
I do have a question. Based on all your work outside of the United States and even the one you're doing in the United States, what do you think are the biggest challenges you see in achieving global health equity?
There's a lot of challenges. Racism is a challenge. The post-colonial colonialism is a challenge. The way that rich countries come into poor countries and think they have all the solutions is a challenge. The way that organizations often come into impoverished communities and think they have all the solutions is a challenge. And then there's the challenge that as Paul Farmer used to say, we've been socialized for scarcity. We think that we live in a world where resources are scarce. It's true that resources are limited, but as Paul used to say, resources are less limited than they've ever been in human history. There's no excuse for people dying of tuberculosis in 2025. We've known how to cure this disease since the 1950s. And so why are over 1 million people dying of tuberculosis? Well, it's a very complicated disease to cure. It's very hard. We don't have all the tools that we need. But the reason we don't have all the tools, that we should have is because between 1965 and 2012, we developed no new drugs to treat tuberculosis because we stopped caring about it. We stopped caring about it because the rich world stopped caring about it. And so to me, it all boils down to that. It all boils down to where we put our attention, where we put our resources. If we had a healthcare system, my favorite example of this, there's a drug that treats malaria that also makes your eyelashes longer. And the version of it that makes your eyelashes longer is much, much more valuable than the version of it that treats malaria. And that's messed up, right? Like, we all inherently know that is wrong. You know, hundreds of thousands of kids are going to die this year of malaria, and the version of that drug that makes your eyelashes longer is more valuable than the version that treats malaria. We know that's wrong because we know in our hearts that all human lives have equal value, but we've failed to build systems that reflect that reality. I didn't realize this was going to be an interrogation.
I learn so much every time we chat, John. It's amazing. You're full of...
It's called Latisse. That's what they call it in America. It's the eyelash lengthener, if you're in the market. It has a bunch of side effects, though. Like, it's not worth it. Just use mascara. That's what I do. You never seen, like, long eyelashes? Oh, no, it's like a coincidence that it makes your eyelashes longer. That's not its main function.
So bridging.
Yeah. I think one thing that was, like I said, I've learned so much from you every time we talk, and I think you do something really amazing in your work, which is to bridge these big macro problems with very, humane stories about individuals and people. Henry Ryder, for example, I've learned so much from his story in the last few weeks since his story was published. And a big challenge we always have is trying to bridge these huge scale problems with that, like you said, that empathy gap and people not understanding what that means. And so I was wondering if you could share a little bit about how you approach that challenge, because I think you've done it masterfully in so many different contexts. And yeah, how you go about thinking about that as folks who are all the time trying to advocate for issues and trying to bridge that gap, sometimes in short congressional meetings, but sometimes, at the dinner table with our families and just talking about the work that, we're so passionate about in public health. So yeah, how do you think about that challenge?
Yeah, there's something weird, right? Which is that statistics don't move us that much. Like 10,000, there's going to be 10,000 cases of active tuberculosis in the US this year. There's going to be 10 million cases of active tuberculosis globally this year. And what do those numbers even mean? Like, y'all can because you're public health people, but like, I literally don't know the difference between 10,000 and 10 million. Is it like 1,000% different? Is it 10,000% different? I'd have to like sit down with a piece of paper in order to know that. But I know that my friend Henry Ryder's life is valuable. I know that his life is important. I know that he's my friend. And I know that when he was on his deathbed, not because the solution to his illness was unavailable or because we had to fly to the moon to get it or because it was made of platinum, but because corporations said that it should cost $1,200. That's why he was dying, was because there was no $1,200 to save his life. I know that that's unjust. And so if you tell the story of one person, you can tell the story sometimes, if you do it right, of many people. And that just moves us differently. It just does. This is why when we go, and tomorrow when we're on the Hill, we're going to have a lot of TB survivors with us who are people who've lived with tuberculosis, survived tuberculosis in the United States, and who are the best advocates for it because they're a reminder to these members of Congress that, like, this is not only some distant, faraway problem. But the more in general, it drives me crazy that we think of distant, faraway problems as distant, faraway problems. Like, what is the difference between everyone I see in the context of myself? This is something I hate about myself. I think of my wife. I just called her my wife, right? I think of my children, my best friend, my sibling, always in the context of me. How do I get out of that mindset and see other people in the context of themselves? How do I understand that, like, yes, I'm stuck for the whole time I'm here inside of this one skin-encased bacterial colony, but like, your skin-encased bacterial colony is as real and as important as mine. Like, there's this great Faulkner line in his Nobel Prize acceptance speech where he said that griefs grieve on universal bones. How do I remember that your grief is as real as my grief and that your life is as important as my life? Like, that's the work of being a person to me.
So I heard you wrote a book about TB.
I did. Everything is tuberculosis. 20 of you are going to be
That
able to
wasn't a
read it.
setup. 1.3 million deaths a year, as you said, just a number to some, perhaps to many on Congress. But you've spent a lot of time thinking about this the last few years, and very personally, as you've noted. What do you think the biggest barriers are to tuberculosis worldwide, and how can we address those?
It's money. It's money and it's attention. It's on some level, it's so simple. It's a resource problem. There's so many problems that aren't resource problems, like that I don't know how to fix. You know, like my brother had cancer a couple years ago. That was not a resource problem, right? Like, he was able to get the kind of personalized, tailored care that anyone would expect, and that everyone deserves. And yet, $1,200 stands in the way of my friend Henry surviving tuberculosis. My friend Henry hears from public health officials, not in this room, but like from public health officials, I'm sorry, but it makes more sense to focus on prevention than it makes to focus on treatment. It makes more sense to focus on cancer prevention than it makes to focus on cancer treatment. It would be more cost effective to prevent future cases of lung cancer by smoking cessation courses than it would be to treat my brother's cancer, but my brother still deserved treatment for his cancer. So the only thing that we deserve is care in this world, is solidarity, is not feeling alone, is being accompanied. It's the only thing that we deserve, is to love and be loved. And so I really think that the answer to that question is human attention and human resources and the reforming of human-built systems. And unfortunately, what we're seeing today is, as you said, we're walking away from those commitments. We're getting further away from the U.S. government anyway. I don't think we in this room are, but the U.S. government is getting further away from making those commitments. It's getting harder to make the case for public health. It's harder to make the case for very basic, obviously beneficial interventions like vaccines, harder to make the case for caring about people in impoverished communities, not just in Sierra Leone or in Congo, but also in the United States. Like, if you map poverty in Indianapolis and then you put the map of diabetes on top of it, it's the same map. If you put the map of cancer on top of it, it's the same map. And so that's the work that y'all are called to do, and I'm so grateful that you're called to do it, but it is a really difficult moment to try to be doing that work, unfortunately.
If I could just add to that, we spend $6 billion a year on TB care globally. $6 billion. The U.S. pet food market, like what we spend feeding our pets, dogs, cats, I had some birds when I was a kid, is $30-something billion. So we spend 5 times as much just in the U.S. on, caring for our fish, goldfish, our koi.
What are you saying about our pets, Vincent?
Sorry. They also deserve care, but I think
But it's an empathy gap.
It's an empathy gap,
right?
Yeah.
Like, I will give my dog, God bless him. He's not even a good dog, Vincent. Not technically. I know there's only bad owners, not bad dogs, but we are apparently very bad owners. I will give my dog all the care in the world. It says a lot. It's something to think about.
Yeah, and it's hard for me to imagine $1 billion, but there are plenty of people who have that much money, individuals who have that amount of wealth, right? And when we think about taking collective action as a country and through our tax system, how we spend our money, a tiny fraction of each of our tax dollars is being spent on global health, on foreign aid. And you all in this room know that better than most people in the country, right? Just what that kind of looks like, what % of the dollar that we spend on that. But, we could do so much more very easily. In a year, we could shift resources tremendously. The creation of PEPFAR, for example, was one of these sea change moments where almost overnight, you saw billions of dollars going into the fight against HIV/AIDS. And we've talked about, what would it look like to have a PEPFAR for TB or a PEPFAR for malaria? Why don't we have that, right? That's part of the empathy gap. It's part of folks on the Hill, for example, not knowing that a lot of people in this room, for example, would probably support that, would want to see that happen, right? And so we have to show up to make that happen, but it's there. It's possible. It's totally possible. Even, it's been pretty dark the last couple months, and I've talked to a lot of colleagues about that and the impacts of policy change in the exact opposite direction, right? Falling down the stairs. But we could easily climb back up the stairs to where we were and far surpass that. It's not something that would take much at all, given the collective resources that we do have. So it's a choice, and I'm hopeful that when you all are members of Congress, so when the next president here, who's in the room, becomes the next president.
From your lips to God's ears.
It's very possible. So make it happen when you get there.
No, that sounded great.
And I have another question, still on TB though, but in this social media era, and most of us don't use Twitter anymore, but we use.
What do you use? Like Be Real?
Sometimes we use TikTok.
They just laughed at me like I was the oldest man on earth.
I mean, you just called us adults, and we're not ready for that.
Clearly. TikTok.
Okay.
Great.
TikTok,
I can dig it.
Instagram, YouTube for some.
Sure.
So how can we use social media to effectively make TB a global health priority?
So it's not just the content you make, it's the content you watch. This is a really important thing to understand about TikTok and Instagram and YouTube. Like, TikTok is in the business of feeding you what you will accept. They are not in the business of feeding you healthy food. They are in the business of feeding you food that you will eat and that you will eat a lot of. So like when I'm on TikTok, when I have like a 2-hour TikTok session, and I know I'm not alone in this, and it's like being a dolphin in the water. And you're just coming up for air every now and again and going back under and then coming up for air and going back under for hours. I don't know about you, but I can do that for a whole night. I can like get into bed at 7 p.m. and be like, how is it 3 a.m.? It's 3 a.m. and I'm watching a TikTok about the importance of good sleep.
Because it's hitting all those dopamine receptors.
Yeah. And I'm like, yeah, good sleep is important. What's next? Keep it coming. I want to stay in the water. But what you watch is so important because it doesn't feel this way. So there's two things that's happening, right? One thing that's happening is that it's the ultimate cure for loneliness. It's the ultimate cure for isolation. It's the ultimate cure for boredom. It's the ultimate cure for I'm having a problem with my friend group. And yet it makes all those problems worse. In this sense, and I feel like I'm preaching to the choir here, but it's like a drug. It's like alcohol, right? Like there's a great Simpsons headline where in Moe's bar, there's a sign that says, alcohol, the cause of and solution to all of life's problems. And that's a little bit what TikTok is now. So like what you watch really matters. If you're engaging with Partners in Health's content, if you're engaging with MSF content, you're engaging with content made from this institute, like you have a completely different feed than if you're engaging with the crap that I engage with at 3 a.m., which is mostly like people cleaning out cow hooves. You know what I'm talking about?
You go there, John? You go there.
Oh, yeah. Yeah. No, I go to dark places. I'll go to a guy who just cleans out eardrums, like gets the wax out. It's dark. It's terrible. I'm not alone. Yeah, I'm getting applause for this. That's bad. No, I'm opposed to it. I don't think I've been clear. Don't do as I do. Do as I say. So what you engage with matters, but then also what you make matters, right? So like if you become an earwax removal TikToker, God bless you, you're going to make a living, But like, are you going to feel good about the living that you're making? No. You're going to feel weird about it. So both what you watch and what you make are critical because that is where your attention is going. There's this great line from Annie Dillard where she says, how we spend our days is, of course, how we spend our lives. And so if we're going to spend our days on TikTok, which I'm not opposed to, by the way, let's be careful how we spend them, because that's going to be how we spend our lives. Great question. Are we out of questions? Oh, okay, great.
I would just wanted to touch on the last one we have here, and then I think we'll open it up for questions from the audience. I'm sure you'd like to hear from others. But you talked a little bit about the empathy gap, and I think it's key, and especially tomorrow, it's not like there's not enough to go around, right? And it's about shifts in funding. We don't have to take anything away from anyone. There's enough to go around, and there's plenty of funding. We just have to have the commitment to spend it on the things that matter.
Yeah, that's absolutely right. I mean, we're spending more in 2025. The federal government has spent more in 2025 than it spent in 2024, 2023, or 2022. So the argument that, like, we have to make radical cuts to federal spending, well, if that's true, then I await the radical cuts to federal spending, because so far we haven't made them. We've made no cuts to federal spending. What we've made is shifts in priority away from human health, away from reliable information, away from science, away from research grants, and toward national defense, toward, I don't know how to describe ICE, toward, various other programs. And so it's wrong to think of this as cuts. It's right to think of it as a shift in priorities that reflects a political worldview. You can agree or disagree with that political worldview, but the idea that there's not enough money for global health or not enough money for public health is obviously a lie. And so we know, we in this room, we all know that, but it falls to us to go and preach that gospel.
Thank you. I think we'd like to open it up for questions from the audience.
One last question.
Yes.
Yeah.
One last question, and then we can ask the audience. My last question is, what advice do you have for us that you called adults?
You're already doing it. You're already doing it. You feel like it's something that's around the corner, but it's something that's already happening. And so the feeling that, like, at some point, I didn't know that I was an adult until I was 34 years old, and I was putting on a pair of pants, and I said, I feel like I look like a middle-aged man in these pants. And my wife said, yeah. And I realized if you double my age, it's not that old. And so I am sort of middle-aged, right? But, like, you're already doing it. You're already doing the work. Just continue the work, grow your connections, grow your passion. It doesn't mean the end of learning when you're done with school. It means the beginning of a new kind of learning. Like, all of these lies that you've been fed that, like, you have to get, like, a piece of paper in order to be a proper adult are just not true. Like, you're already doing the work. Just continue to do the work and deepen the work as you go.
I think I'll just take some hands. I see 1 and 2, 3. Actually, I'll defer to Dean Goldman first. Since Lynn.
First, Dean, the Dean's first.
Oh, the dean is first.
I need to start by confessing that I've cleaned out a lot of ears, but I'm a pediatrician, so
Oh, yeah. But you didn't do it on TikTok. You really missed an opportunity.
film it. No, and, that was before the days of, having GoPro in the clinic and stuff. But but I would say, so, the people every time I'm up on the hill, I'm in an elevator or I'm, in a room, talking to staffers, I run into one of our students. And you say they're already doing it. A lot of them are already doing it. I mean, it's amazing. And they're writing legislation and they're advising their members how to vote. And it's one of the wonderful things about doing public health in this town, having public health students kind of infiltrating Congress. So I don't know how many of you have jobs where you either go up on the Hill or you are with a group that lobbies the Hill or somehow get involved. Come on, put your hands up. Yeah. Yeah, it's incredible. Anyway.
I think she was 4 rows behind you. And then
Hi, everyone. First and foremost, John, thank you so much for getting me through high school, as some of us have said. Yes. You've actually gotten me all the way to medical school at GW now, so I don't know if I would have gotten here without you.
One day you will like be my doctor. So I'm very grateful to you in advance. And clean my ears and
cleaning the
everything.
ear,
Yeah,
too.
if I'm lucky.
Yeah, yes, maybe TikTok too. My question has to do, I've been thinking a lot as a medical student with a public health background, how we get more folks in the health professions and even public health students involved in advocacy. I think folks in this room by and far are those that are really interested in advocacy and to work towards progressing the priorities we've been talking about, but that isn't everyone. So if you or even the entire panel could just talk to what are some strategies or things you've been thinking about of how we can get more folks really engaged and involved in advocacy, both at the local level or even all the way up to the federal level like we are in DC.
So I think we have a lot to learn from religion on this front, evangelistic religions in particular. Like I grew up, and I am still a Episcopalian, which is a little bit less effectively evangelist, but still in the category. And I think we have a lot to learn because, like, they don't just talk to their members of Congress, they also talk to their friends. They're always like, how are you with your faith journey? You know? We got to ask that. We got to say, like, how are you in your advocacy journey? We got to talk and pressure our friends. We got to preach the good news, not just to members of Congress, but also to our actual social networks.
Can also add into that, or just a little bit, I can say, yeah, talk to people. I mean, I told my parents I was doing a master's in healthcare administration, and they're telling everyone that I'm a doctor. So now people call me asking stuff that I'm not even in medical school. But the point is, I stay educated. I look for information. I look for not just information on TikTok, but I try to stay educated and to just know my sources and everything. So know what you're studying and then just talk to people.
I think we had the second one over there, and then maybe I'll move over to this side.
Hi, I have OCD. I know you have OCD, John, and I'm wondering about those more like invisible illnesses and how we can advocate for better care around the world because I know the care I've received in the US is so important to me and has changed my life. And I think about all the people who don't have access to that type of care.
Yeah, that's such an important question. It's a huge focus for Partners in Health right now is on mental illness and mental health care. You know, I visit, every time I go to Sierra Leone, I visit the only psychiatric hospital in Sierra Leone, and it wasn't long ago that patients were still chained to their beds. And, you know, someone like me would have very possibly been chained to my bed because I would have been a threat. I would have been a threat to myself, and that was the only way that they could control that threat that I posed to myself because there were no medications, there was no pharmacy. I think it was you who showed me the largest psychiatric pharmacy in Liberia, which is, about this big. And so it's a huge issue. And, the truth is mental health, if you measure the burden of on a healthcare system by disability adjusted life years, by the burden of disability, mental health is one of the leading causes of disability in the world, not just in rich countries, but everywhere. And yet we devote almost no resources to addressing mental health challenges. This is also a problem in the United States. I mean, we have a terrible triage system in the United States. Recently, a few months ago, I had a mental health crisis, and I called my psychiatrist's office, and I said, I don't know what to do. And they said, well, what do you want to do? And I was like, when I go to the hospital, they take my blood pressure and they tell me if I'm having a heart attack. And like, I don't know what the equivalent to that is, but that's what I need right now. I need you to tell me if I need to be in the hospital, or if I need to like go to the doctor tomorrow, or if I'm okay to wait a week. Like I need you to triage me. And there is no triage system for mental health care in the United States. And so I think it's an issue both globally and locally. And like you, I have benefited tremendously from high quality mental health interventions. And yet still, even with all of the privilege that I enjoy, I found myself in the situation where I was really in crisis and didn't know what to do and didn't know who to call. And when I did call, the only person I knew who to call, they didn't know how to tell me what to do. And so if you're going into that field, thank you.
think Sloane's in charge of the mic now.
That's okay.
Can I just add? So
Hello.
there's a global mental health roundtable, and unlike TB or HIV or malaria, there is no funding for global mental health out of the U.S. government. So there's no global fund, there's no PEPFAR. The total amount of funding is literally $0. There's a USAID mental health coordinator who has a staff of 0 and a budget of 0. And so we are just trying to get that going. So Partners in Health is involved in coalitions that do advocacy on this, but we need your help. We don't have those mechanisms at all for funding, and we could, and we should, and you can be part of that. Like I said, email me, vlin@pih.org.
Vince is going to get a lot of emails.
That's great. That's great.
He will answer them.
I know, I know.
Let's choose someone. Oh, go ahead. Yes, you have the mic. You have the floor.
And a shirt with my face on it.
That's true. I got all my friends to wear one too.
Oh,
Anyway.
amazing. Oh, my God. Incredible.
Anyway. First of all, thank you for your question. That was so interesting, and thank you all for being here. My question is, I know you to be a person, and I think I know everyone else in this room to be a person who believes in the idea of radical hope and collective action, and I think it's something all of us in this room believe in, but it's something that's very difficult to communicate to people who have not been part of it, who haven't seen it work, who have been disenfranchised, especially we've talked about today. There are people in this world who have a lot more power than us individually, a lot more money than us individually. How do you communicate with somebody who doesn't believe in the idea of hope or the idea of collective action, that it's effective and that their voice matters and makes a difference?
I'd be interested to hear what y'all think about that, but my position is that there's no room for cynicism. Cynicism is a luxury. Hopelessness is a luxury. I'm somebody who's very prone to despair in my life. It's very hard for me to, but hope for me is not some abstract idea, floaty up in clouds kind of business. It's a prerequisite for my survival. And so it's a fight, it's a daily fight, but you got to fight that fight.
Thanks. Let's take one over here. Yeah, I think Sloan has the mic.
Given the current state of our health administration,
Is it going good?
no, not at all.
Thanks for the one-word answer.
But I know that in this country, there's a lot of people that don't necessarily have trust in our health system, or trust not even just in this country, but just globally. How should we go about trying to educate or try to help encourage these people to join our movement while also trying to drive away this lack of trust?
It's a big question and a really important one. So I'll give you one example from my own life. My friend Henry, he got drug-resistant tuberculosis probably because when he was 6 years old, his father pulled him out of treatment and said, this is not a disease for the doctors, this is a disease for faith healers. And because his treatment was interrupted in the middle of his course, he developed drug-resistant tuberculosis, and that's why he almost died. It's very easy to judge that decision that Henry's dad made. On the other hand, what in the Sierra Leonean healthcare system had ever given his dad a reason to trust the Sierra Leonean healthcare system? This is a profoundly impoverished healthcare system that was in a state of collapse in the wake of a civil war, and then in the wake of an Ebola outbreak that killed nearly 10% of all Sierra Leonean healthcare workers. And so how could I ask Henry's dad to believe in a system that hadn't provided for him, that hadn't done a good job of being a trustworthy healthcare system? Not because the Sierra Leonean people or healthcare workers didn't want to, but because, if Sierra Leone spends the same percentage of its GDP on healthcare that the UK or Germany spends, they have about $58 per person per year to spend on healthcare. You can't build a healthcare system for $58. You can't pay for 2 months of my OCD prescriptions. And so that would be my first response, is how do we build trust in the healthcare system? Partly by providing a trustworthy healthcare system. And you don't have to go to Sierra Leone to see radical healthcare inequity. You see it right here in where are we? Washington, D.C. I almost said Boston. That's where I'll be tomorrow. But you see it right here in Washington, D.C. That's like that moment in Spinal Tap where the drummer is like, hello, Omaha, and he's not in Omaha. Sorry about that. But yeah, so you see it right here. You see it in D.C., you see it in my hometown of Indianapolis. You see that when people can't trust the healthcare system, they don't trust the healthcare system. And so part of the answer to that is education, information, listening empathetically. But part of the answer is also a healthcare system that works.
A lot of my work in advocacy in the last year or so, the last 3 years actually, has been around tribal health inequity in the United States. And talk about broken promises and treaties for hundreds of years, right? The life expectancy in Rosebud is 52 years. And I've learned so much from my colleagues here at PIH about this. Being there for decades is sometimes what it takes. Listening to the community, setting up systems where the community teaches the doctors and the clinicians and the health system and has a real role in leading that, the development of those structures is the way to do it, but it takes decades sometimes. I mean, we're talking about hundreds of years going in a certain direction, broken promise after broken promise, and talk about underfunded health systems in the US, right? Indian Health Services budget compared to the average spending on spending per capita on healthcare in the US. So I think there are so many, like John mentioned, inequities within the United States that we have to grapple with the exact same dynamics. I mean, syphilis in Tuskegee, there's so, healthcare in Puerto Rico, there's so many things that have broken trust over years. And I love that John's work is grounded in that historical context because it really does give us solutions that have a much better chance of actually succeeding. Because unless we face that history, unless we integrate that into what we do in public health, in medicine, then we have no chance actually at being successful, regardless of our sort of best intentions.
So unfortunately, it's 8.
Yeah, I
and
saw a
it's
lot
time
of
to
hands
bring
over
this
there.
to a close. There are many hands that are up, and I am going to ask that as we close, those in the auditorium, if you could stay seated for a couple of minutes because we're going to take the speaker across the hall. Thank you.
So I don't know if you know it, there's another room across the
Oh,
Oh, I get
hall.
to go say hi to them?
Just as many people.
Yay!
waiting.
We have,
And they would love to see you.
I'd love to see them.
yes.
Good.
But before closing, just to communicate the incredible gratitude that we all feel to you, reminding us of the importance of empathy in particular, and that it's so easy, as you say, as you're going through the TikToks, or in my case, it might be other media in the New York Times or other things, it's easy to feel angry. It's easy to feel despair. And I don't think that it works to confront anger and hate and negative energy with more negativity. And I do think that we all need to be the messengers of empathy and the importance of caring, and that, the things like the work that Partners in Health does, but also AID and PEPFAR and all of those efforts, we need to build on those efforts, and that we aren't being ripped off, for God's sake, when we help other people. We are actually being lifted up, and I hope that you, John, are able to continue to go around and speak to people. This has just been a wonderful lesson to all of us. We in public health are not always good at communicating the empathy and telling the stories, and I think we all learned a lot from you here tonight. Thank you so much.
Thank you, John. Thank you.
Do I actually get it?
Yeah.
I feel like I'm feeling it.
While you all are waiting, I have one little announcement. If you wanted PE credit for today, there is a registration table out front. You can either turn in your fun ticket, your golden ticket for your book, or you can also scan the QR code so that you can get your PE credit.